You may have seen in movies or TV a character who has two personalities, totally unaware of one another. Take the recent Disney Plus series Moon Knight, where the main protagonist, Mark Spector, struggles to contain his multiple personalities, including Stephen Grant. One might be angry and mean, while the other kind and caring. This phenomenon is known as dissociative identity disorder or multiple personality disorder. I'm Dr. Adam Goodcoff, and today we're talking about how it's possible to have two personalities in one person. The field of psychiatry is fascinating, and neuroscientists, psychiatrists, and psychologists alike will tell you that we truly only scratch the surface in our understanding of how the brain actually works. Conditions that are more common, such as depression and anxiety, have been studied extensively and have clear neuroscience behind them to offer explanations. Disorders, on the other hand, such as multiple personality disorder, are a bit different. Not only are these conditions often more rare, they are also less easily explained by neuroscience and more often understood through the lens of behavioral science. Dissociative identity disorder is a condition where patients actually possess two or more separate identities. Each identity is as if there is a unique person with their own driver's license, educational background, and job. With these personalities come specific hobbies, interests, sexual attractions, and so forth. It's even possible for these personalities to have different accents and voices, like this.
All right, go ahead, you're in. Cheers, thanks a lot. All right.
So what causes these patients to live a double life? Well, many psychiatrists speculate this is due to emotional trauma early on in life. The creation of another personality can be a coping mechanism for a stressor or event that was traumatic. One famous example is now retired NFL star Herschel Walker. He explains that his journey from childhood to professional NFL caused him to develop a toughened personality to protect himself from the fear or abuse he endured during his rise to fame. In the example of our fictional character, Mark Spector, I did this timestamp if you don't want any spoilers, we find out Mark had a traumatic and abusive relationship with his mother. This caused Mark, who we now know was his original personality, to come up with Stephen Grant, whom he could hide this abuse from. We learn that Mark created Stephen so that he could experience a normal life without all of the trauma. So how are patients diagnosed with dissociative identity disorder? Well, as with many psychiatric conditions, that refers back to the DSM, or Diagnostic and Statistical Manual. First, patients must have two or more distinct identities or personalities. Next, they must experience amnesia, or memory gaps, each day. Third, they must find this distressing or troublesome, or have some trouble functioning in life secondary to this disorder. Fourth, this cannot be part of normal cultural or religious practices. For example, children playing with imaginary friends would be considered normal behavior. And lastly, these symptoms cannot be due to any other substance or medication that influences a patient's behavior or thought process. Whew, that's a lot of rules. So how can we treat these patients? Well, with or without the formal diagnosis, there are limited therapies proven to work. The most common therapy that is trialed is known as cognitive behavioral therapy. Cognitive behavioral therapy, or CBT, works to help a patient gain insight into what is creating their problem. The goal is to help them change the way that they think or feel about these experiences. Another mainstay of treatment for these patients are the typical psychiatric medications used to manage their symptoms. Psychiatrists, or physicians who specialize in mental health, are experts in this space and can determine what is the best approach for each patient. So in the end, you can have multiple personalities in one person. Mark Spector and Stephen Grant are a prime example of this. Two totally unique personas with varying knowledge bases, preferences, self-defense skills, and desires. If you enjoyed today's video, be sure to hit the like button and let me know in the comments down below what you'd like to see in the next video. As always, click on that subscribe button to have your health explained.